Good. So a pleasant good evening to everyone. We're doing a new live for you guys at Batson and Associates, and the live that we're going to do tonight, which is something I actually came up with uh, just yesterday, to be all honest. And the reason why we came up with this is because we have a lot of clients that come to us. The topic tonight we're actually discussing is hormonal imbalance, hormonal disturbance in women. And the reason why I decided to do this four-part discussion is to really highlight to individuals how serious this problem really is. Simply because a lot of persons do not understand what women go through when they are experiencing hormonal imbalance. Keep in mind, we are live on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. And on YouTube, we are Batson and Associates Trinidad. You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates, where our job is to support your health naturally. We already have on our Instagram. Remember, we are Batson and Associates TT on Instagram. We have Mr. Leith has just joined us. We also have Mad Max 30, and we also have yes. So, as I said, this evening we'll be discussing hormonal disruption in women. And it's going to be a four-part series that we do beginning this Monday, and it continues subsequent 3 Mondays or 4 Mondays in succession, today being the first Monday. Good. And as I said, the word will eventually spread, especially by next week. Please God, I believe we're going to have a lot more persons on the live. But of course, remember to share this live. And as I said, the reason why we're doing this is because of the amount of women who have serious hormonal disruption. And it is reaching the point where this situation, if it's not dealt with properly, could actually lead to mental insanity or even death. That's to tell you how severe the situation is. We're going to discuss what really is hormonal imbalance, what is really hormonal disturbance in women. Is it that only a particular type of woman experience this, or is it that women of all ages, teenage years, is it women in the mid-20s, very young women? Is it much older women who are, more advanced in age, in their 60s, for example, or maybe 70s? The thing is, what I could tell you, this particular issue affects females from the point that they start to menstruate. It can actually affect them from that point. So we know young ladies now get their menstrual cycle much earlier. Young ladies, maybe about 20, 25, 30, 35 years, 40, even 50 years ago, may have started menstruating at the age of 15, 16, 13, 14. But now we have young women menstruating much earlier. And of course, we know that is because of the diet. A lot of the foods that we have now, because of the population, they would have to, well, not necessarily have to, but what they do is we have a lot of hormones in our food now. There are a lot of phytoestrogens around, which is plant estrogens. There's a lot of estrogens in a lot of dairy, in a lot of the meats. So as a result of consuming that, you find that hormonal or a woman actually being able to see or beginning to see her menstruation is much earlier now as some years ago. So you have young ladies who would get their menstrual cycle as early as 7, 8 years. Good. So the point I'm making is that this particular issue that we're discussing here, hormonal disruption in women, in females, can actually begin from the point in time a female begins to menstruate till she dies. So we're talking about a lot of time there. We're covering a lot of ground. And it is quite unfortunate that a number of persons did not understand that that was in fact the case. Because a lot of medical professionals were of the opinion that women could only go through hormonal disruption or hormonal imbalance when they are going through menopause. And they believe that it's only when a female goes through menopause that she can have hormonal disruption or hormonal imbalance. And I'm here tonight to tell you that that is not the case. A female can have hormonal disruption. I want you all to listen to me good. And ladies, I want you all to listen to this program and share this program with your friends, because let me tell you something. As I said at the beginning of the discussion, this thing is so serious that women could actually and are actually going insane. Listen to me carefully. They are being diagnosed with things like eventually bipolar, they're becoming schizophrenic, they're becoming serious insomniacs, and they are also becoming serious central nervous. They're becoming literally getting nervous breakdowns. This can actually cause women to die. So that is why I said I'm going to do this four-part series where we discuss hormonal disruption in women. And as I said before, this is a situation that can affect a female from the time she starts a menstruation to the time she's dead. And as I said before, that is covering a long, long period of time, ladies. So if you send this to your sister, your mother, your cousin, your friend husband, because a lot of men going through a lot of issues as a result of this because of women. And this is not a blame game situation, but it's simply a situation where men in themselves do not understand. If they are medical practitioners who don't understand this and they are trained doctors, what do you leave for husbands, brothers, fathers in this situation where they themselves do not know? Think about it. That's to tell you how serious these things are, ladies. We are live, as I said before, on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. Let me say a pleasant good evening to Miss Vidya Abdul. She says good evening all. She's in the house. Miss Alicia Spears, good evening to you. Akil Bruce, good evening to you as well. So we also have Miss Jennifer Valentine from Texas, actually just joined us there. She is in on the program. Miss Pearl Prasad, she says, good night to you, Dr. Batson. Long time. So happy to see you again. God bless you always, my dear. Thank you so very much, as well as Miss Ruby Sami. So I like it. The live starting to get full because this was actually a surprise program. I only planned to do this program yesterday. And as I said, the reason why I planned to do it is, or decided to do it rather, is because of the amount of women that actually come into Batson and Associates now with this problem. But my issue and my concern is the severity, the suffering, the nonsensical suffering that these women going through for nothing. Listen, ladies, all you're going mad for nothing. And I'm going to be very blunt and blatant tonight. Believe me, I'm taking off the gloves, right? Because this is a serious issue, and I think a lot of people don't understand how serious this is. It's very, very serious. Okay, Miss Lee Joseph actually asked a question. It says, Joseph says, good evening, everyone. Good evening, Doc. How much hormonal disruption is there if a large fibroid is not partially calcified? Um, that question is a bit strange in the sense that, strange, but it makes sense. So, the hormonal, okay, let me put it this way. In order for a female to have a fibroid, especially a large fibroid, it means that hormonal disruption is very, 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 very high. Because fibroids is a consequence of hormonal disruption. So Joseph started it off tonight with that particular question. Because one of the things I'm going to discuss in this four-part series is actually discuss with women how each of these hormonal disruption issues are and how it affects you. So we're talking about weight gain. We're speaking about fibroids. We're speaking about polycystic ovarian syndrome. We're speaking about diabetes. We're speaking about vaginal dryness. There are a lot of women when they go through hormonal disruption. So this is not only menopause we're speaking about here, no, women. This is in some cases before menopause, during menopause, even long after menopause, 10, 15, 20, 25 years after you have gone through menopause. There are women who have hormonal disruption so bad that they have severe vaginal dryness, that they want to have absolutely nothing to do with their partner, whether it's your husband, common law, married, boyfriend, whoever it is. They do not have the desire, or in some cases, they have the desire for intimacy, but because of the vaginal dryness, intimacy is very painful, it's very uncomfortable. So you will want to put yourself through that. So we have a lot of men now. So that in itself is going to create a tremendous, tremendous issue as it relates to problems in the marriage. Because your husband is going to say, but what happened to this woman? This woman not giving nothing. But he doesn't understand that it's not like you don't want to give up the thing, as we say in colloquial language. But it's because you not feeling any kind of intimacy, you're not feeling to talk to this man, you even feel to see him rather. So worse yet, you even need to lie down to do nothing. And that is because of hormonal disruption. So, ladies, as I tell you all, this is a 4-part series. It's going to take place every Monday night, or the next 4 Mondays, God's willing. This Monday being the first Monday, and it begins from 8:30. I go to 9:30, 10, because I feel by the time we reach maybe the next one, we're going to have so many more persons on this live because of how this affects women significantly. Okay, let me just answer a question quickly, because I will address other questions apart from what we're discussing, but keep in mind it is hormonal disruption that we're speaking about women. So postmenopause, premenopause, problems with anxiety, depression, all those things we will be touching on. Let me just answer this question. Miss Vincia Coffee Charles, she says, good night. What can be done to resolve a swollen lymph node under the left arm? Okay, well, one of the things, I don't know how swollen the lymph node is, one. I don't know how long the lymph node has been swollen. But of course, remember, swollen lymph nodes indicate us sites of infection. It indicates our immune system functioning to the point where it is actually dealing with an infection. So it means that somewhere in the lymph node under the left arm there, you have some sort of infection. Now you need to be very careful with that, because if you're experiencing pain or discomfort in the left breast as well, it could also be an indication of serious issues, right? I don't want to go in front or go in a place that I shouldn't, but that is definitely alarm bells ringing there. So you need to be careful. What I would suggest you do, look at your water intake. I don't know how much water you drink, but you should be increase your water intake. You should see some sort of medical professional as well, because what they may have to do is eventually do an ultrasound or do MRI or something like that, if that situation doesn't rectify itself. But it is an indication of some sort of infection. It could also be an indication of some sort of blockage taking place in the left breast itself, or somewhere in the lymphatic ducts on the left side of the body there. So you need to pay very close attention to that. As I said, I don't know the severity, so I don't know how much it is swollen, and I don't know how long it has been swollen. Maybe you could share that information with me, and I could give some advice as regards to that. You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates. We have I don't even know how I'm going to pronounce that, but it's Jahid. And she says, good evening from Canada. Sintra El Ramada. Good evening, Dr. Miss Margil. She says, good evening. Oh, gosh, we're going and get some buff tonight. You're definitely going to get some. Betty Phillips says, good evening, Dr. Batson. And, of course, Vincia Coffee Charles as well. We have a question on our Instagram here. We have Miss Jennifer Valentine. She says, good afternoon, Dr. Batson, and all locked on. Dr. Batson, the person I told you about with the cyst on the bladder, the doctor wants to do surgery. What do you think? Well, the thing is, surgeries are in some cases needed, depending on the severity of the situation. Of course, Ms. Valentine, I do not have full access to all the information, so I really cannot say to this point if surgery is warranted or not. What I can say is that it would allow that individual to really maybe get an alternative piece of advice where the information is provided. So if I don't know how severe the situation is, but if she could at least do a consultation with us, for we do international consultations, well, then we would be able to correct that situation. You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates, where we support your health naturally. As I said, we're doing this particular live, our four-part series on hormonal disruption, and it's going to take place every Monday. Today, 4 Mondays, today being the first Monday, and that is going to take place because we decided to speak about hormonal disruption because, as I said, hormonal disruption in women, a lot of persons have the misconception that only women who go through menopause, experience hormonal disruption. And the thing is, that is not the case. What actually is hormonal disruption? Hormonal disruption in women, or what is known as hormonal imbalance, can actually affect females from the point that they start to menstruate to their death. And as I said before, that's a broad space. A lot of persons believe that women only experience hormonal disruption during menopause. That is not the case. Because you have a lot of women, hormonal disruption includes polycystic ovarian syndrome, it includes diabetes or consequences associated with that. It also indicates issues with anxiety, depression, serious mental health challenges women with hormonal imbalance goes through. So at Batson and Associates, where we have an integrative hormonal imbalance clinic and an integrative hormonal imbalance protocol, we encourage women to come to us, determine exactly what is the root cause of the problem. Why are you having hormonal imbalance challenges? Is it that you have a problem with your gastrointestinal system? Do you have inflammatory bowel conditions that could further exacerbate situations and actually cause or contribute to endocrine problems? Because the thing is, hormonal disruption is a clear indication of imbalance in the endocrine system. So we have to actually go back now and determine the root cause of the problem. So a female who has hormonal imbalance or suffers from hormonal disruption, she would have problems with fibroids, polycystic ovaries, ovarian cysts, endometriosis, diabetes, anxiety, depression, vaginal dryness. They actually have a lot of issue with disinterest in having intimacy with their partners. And the reason for that, as I mentioned before, is because of the vaginal dryness. A lot of these women do not even want to have intercourse because of how painful it is. So it's not as if they're holding out on their husbands or they're being moody, even though mood changes are also a sign of hormonal disruption. It is because these women physically now have such vaginal dryness that they're not in the mood at all to have any sort of intimacy with their husband, boyfriend, whatever the case may be. And that's why men as well need to pay close attention to this, because you know the old saying, happy wife, happy life. So if your wife suffers from hormonal disruption, then that is something that you need to be aware of. And that is why Batson and Associates is doing this. Okay, keep in mind, we are live on our social media platforms. I answered that question for Miss Jennifer Valentine, and she responded and said, okay, thank you, because they need to get some more information for us. And also, they can actually send the client to do an international consultation. They can call that number for our international clients to do the consultation. That number is 868, that's 868 373 2388. Again, that's 868 373 2388. That number is for our international clients to actually book their online Zoom consultations. Okay, so we're discussing hormonal disruption. So I see the questions coming in, a lot of questions coming in. So let me try and see if I can play catch up. Let me go to Wendell Myers, sorry. He says, good evening, Dr. Batson. How effective is a food detox compared to a Santulan detox? Good question. A food detox is beneficial. It would do some good to the body because actually the largest pores in your body on their feet. And because toxins have polarity, all toxins have positive polarity. They're actually able to pull a number of toxins out of the body. So you do get, better sleep after food detox. You find your energy level is better. Santulan detox now is a little more in depth in the sense that Santulan, which is orally taken, liquid product, actually is a 7-channel detoxifier. So it actually cleans and detoxifies 7 channels of elimination, which is kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. So in that particular case now, you find it is going to allow waste to exit different channels. And that, of course, is very important. So, I mean, I don't think they could really be compared. If I was to pick, I was doing the Santulan if I had to choose. But of course, if I could do both, then I could do both. And at Batson Associates, we offer both. It's very easy for both to be done and get, of course, mutual, or not mutual, but benefits, from both aspects or protocols of detoxing. Okay, that was Mr. Wendell Myers. J. Love says, Dr. Batson, blessed night. In regard to gallstones, can it be flushed out or does it require the gallbladder to be removed? The thing is, because of where your gallbladder is, doctors are of the opinion that gallstones cannot leave the gallbladder. That's not the case. The thing is, if you have gallstones and because of the location of the gallbladder, all gallstones come from people who are dairy, most of the time, persons who use a lot of dairy. In some cases, maybe persons who may use a lot of cruciferous vegetables, people who are dehydrated, so you do not drink sufficient amounts of water. And what eventually happens is that gallstones, because the body cannot break down that fat, gallstones gather in the gallbladder. Now, the thing is, and we have Santulan is actually a product. We know we're waiting on that. We'll be getting that product in stock shortly. Actually helps to remove gallstones. We have used it with a lot of our clients and gotten really good results. Also, if you use a mixture that actually has olive oil in it as well, that could actually help in that situation. So it's a matter of getting, you'll have to flush that system properly, but there are things that you can use to flush the gallstones out. An ultrasound would help us to determine, of course, depending on the size of the gallstones, that type of thing, so that we could now do the protocol in such a way that we sort of dot our I's and cross our T's based on the additional information that we would have received. Okay? You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates, and we're discussing health, primarily our 4-part series, which is going to take place every Monday night. 4 Mondays, today being the first Monday. So we have actually 3 more Mondays. I will give you the dates of those. So, of course, you can actually share this with your friends. You could always like us, share us, tag us. I'm trying to get the lingo down. There's a lingo that they have where they say there's a particular sequence in which they say it. I don't know, for some reason I cannot get it. I just maybe never really paid attention to it in all honesty. So this lecture series that we're doing, which began today, is going to be, so it's going to be the 8th, the 15th, the 22nd, and the 29th. Again, that's the 8th, the 15th, the 22nd, and the 29th. By the way, we have to also let you guys know that we're actually having our symposium for our Chagonas office on Sunday. That's Sunday, the 21st of July. So that is something that it's a good thing I look at the calendar. I remember that. So actually Sunday, the 21st of July, God's willing, we're going to have that symposium at Batson Associates. That's going to be taking place at our Chagonas office. That office for Chagonas, of course, is 222-8261. That's 222-8261. And you need to get registered for that symposium. So I suggest those of you who are interested, symposiums are always good, especially the ones that we have at Batson Associates, because of what we actually able to do, in the sense that, it's very informative, demonstration packed. So we actually help persons to understand the importance of actually being able to understand their body better, actually able to understand what a live blood analysis does, actually being able to understand what the magnetic resonance analysis does, actually being able to understand how we use that, not necessarily as a diagnostic tool, but as an indicator of early warning signs in the body. Because you see, there are certain signs. I always tell persons this: you do not get sick. You do not get sick overnight, The unfortunate thing is a lot of y'all, or a lot of us, do not mind our business. So if we mind our business, when our body speaks to us, then we will actually pay attention and go and start to see about ourselves. But a lot of us don't do that. Sometimes maybe it's not necessarily, I wouldn't say it's no fault of your own, but sometimes I know, there are so many things that you have to do financially and family wise. You might be caring for a loved one, you might have children that you have to deal with, you have a family to deal with, you have to work, and then you have a lot of traffic. So our time is shortened. So because of that, people tend to neglect themselves and focus on what they have to do. But I always tell persons, the saying that they have, that your health is your wealth, is not just a broad statement, it's a statement that encompasses so many things. Because if you're not able to work, if you're not able to earn, you are in serious problems. And if you are ill, it doesn't only interfere with your ability to earn, but it interferes with your ability to live. That's the problem. Illness interferes with your ability to live. You know how much people suffering out there, in some cases, as far as I'm concerned, for no reason. But a lot of persons are not aware of, what dealing with the human body is. And, we have a lot of persons, as I tell people, I'm not in the politics of medicine, simply because I try to help persons to understand their body and understand how to take care of themselves. Because we are not proactive. The Asians have always been proactive. Asians, if you want to call them Chinese, well, Chinese also make up Asians, right? So you have the Koreans, you have people like Malaysia, you have the Philippines, those type of people, persons in these blue zones, Japan, and that type of thing. Look at all these people. Why is it that if you look at them on a broad scale, they have challenges, yes, but not as much as the Western world. And that's because of the practices that they have. And we know this. Even the medicine that they practice is a different types of medicine from the foundation aspect of their medicine. Because if you look at Ayurvedic medicine, which I was fortunate to have a lot of studies in, Chinese holistic medicine, it is medicine that looks at things from a holistic perspective. So it's not like allopathic or Western medicine, which is one-sided to an extent in looking at how you deal with the human body. Because you cannot treat symptomology only. Symptomology, just like what we're discussing tonight here with this hormonal disruption in women, symptomology is a reflection of a greater problem, always. In all instances, it is a clear indication that something is wrong a long time ago. And you now have a consequence, which is diabetes, which is fibroids, which is hormonal imbalance, which is polycystic ovaries, which is depression, which is anxiety, which is diabetes, which is hypertension, because those are now a consequence of something that started a long time ago that you didn't pay attention to. I tell you all, you're getting some buff tonight. So some of us just have to take responsibility, because a lot of people just get sick and take themselves out of it. I don't know, why did I get cancer? Why didn't you go and do your pap smear and go and do your breast ultrasounds as you were supposed to, as a preventative measure? And you would have realized that something was wrong a long time ago. When people come to Batson Associates and we explain that blood analysis for them, they are amazed. They are amazed. You know why? It is so telling. So keep that in mind. That health symposium, Batson and Associates. Remember, we had our health symposium last year, which was Davy, and we promised that we would have a number. So we're actually doing some more in the very, very near future. So the first one we're going to have is actually on the 21st. That's Sunday, the 21st of July. So it's on a Sunday. And of course, you need to call and get registered for that symposium. That's our health symposium that's going to be taking place at the Shagonas office. That telephone number for Shagonas again is 222-8261. That's 222-8261. You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates, where we support your health naturally. You could also WhatsApp us on 314, that's 314-9975. Again, that's 314-9975. That's for our health symposium taking place at our Shagonas office. So that's at the Shagonas office, first floor. Keep in mind that that office is a first floor office. So if you have some challenge with mobility, then you would have to wait on when we having the other ones where is an area where you can actually access the one. I know we're going to be having one for Port of Spain shortly. Port of Spain, the one for the North or Port of Spain area all around there is actually going to be in August. I have to confirm the date for that shortly, but that is going to be August, God's willing. So you can always stay tuned for that. And this, of course, 4-part series that we're doing with hormonal disruption in women, we're going to be taking place on today's the first Monday, which is the 8th. The next Monday as well is going to be the 15th, the 22nd, and on the 29th. And the reason why I decided to do this on those Mondays is to help you ladies out there to understand how serious this hormonal imbalance and hormonal disruption issue is, and how you can help yourself, literally save yourselves. Listen to me, anything that makes someone think of committing suicide, you all heard what I said? Anything that has the ability to make you want to kill yourself or commit suicide, to me, warrants serious, serious attention. That's not a joke. And there are women out there suffering. When I tell you you're suffering for nothing, absolutely nothing. You're wasting time. And this is a buff because you don't know how to help yourself. If you don't know how to help yourself, let someone who can help you help you. Simple. And that is where Batson and Associate comes in. Okay, so let me catch up with some of the questions. Where am I? So I'm by Akili Bruce. She said, if a woman's family has a history of hormonal issues, how soon as a child from that lineage starts her menstrual, should one look for early signs, and what's the first step should one take when menstruation begins? Okay, that's a good question. If a female has some genetic predisposition, because note how I put it, genetic predisposition. So there's a saying I have: genetic loads the gun, lifestyle pull the trigger, and I live by that, because I always tell persons you can actually feed yourself well enough that you can change genetics. And if you don't believe me, there's a lot of research out there that proves that. Not so much in the Western world, but there's information. I always tell persons the most comprehensive study on nutrition is the China study. And if you research the China study was done, I believe it was with the University of China as well as an American university. I think it was Harvard. And I will get the information a little better for you guys. I'm going off the top of my head here. So I know definitely it is called the China study. It was done by the University of China and I believe an American body as well. And it was extensive in looking at nutrition and how valuable nutrition is to the human body and what nutrition has the ability to do. And that's why I always tell persons that genetic load the gun, but lifestyle pull the trigger. So in a case like that, Akili Bruce, what I would say, definitely that child should be hydrated. She should be drinking the required amount of water for her body weight. She should also have a diet that has a lot of nutrient-dense greens in it, a lot of vegetables, the fruits, also some form of activity, exercise, to keep themselves in a particular manner. Okay. Miss Valentine, that question I will address it on your WhatsApp. I'll send that information for you on your WhatsApp. Okay. Yeah, Akili Bruce. So that is what I would say. The nutrition is very, very important. That's the next thing. Let me just touch on something here. If you know you come from a family, and Akili Bruce, I'm not buffing you here, my dear, I'm just making a general statement. If you know you come from a family, like me, for example, I come from a family that have a lot of diabetics. I don't play with sugar. I don't play with alcohol. I mean, I drink occasionally. I have a sweet tooth, or I can have a sweet tooth, but I'm very careful what I eat. I try my best to exercise. So I try to do a number of things to not put me in a situation to become a diabetic. So if you know you have some genetic predisposition, because people just say, hypertension in my family, but you're weighing 300 pounds. Of course you're going to be hypertensive. So what you're going to say, because of your family, you're obese? Come on, you have to stack the odds in your favor. You can't want to do everything bad and you come from a family with a set of issues. Now, am I making any sense, or am I making sense? So you have a family history, which we know, as I said, persons who have a genetic predisposition to issues, and you going to eat the worst. You're not going to exercise. You're not going to drink water. You're going to eat a lot of processed food. Of course, you're going to get what they had. And that has nothing to do necessarily with so much the genetics, but the lifestyle that you choose to live. There are some people who do not take care of themselves because they just believe that it's a waste of time, and why I spending money to go by the doctor and check myself. There are people who honestly believe that they should not do those things. And there are persons who tell you they don't want to know. There are people tell you that if they're sick, they don't want to know because they believe in their minds that if they know, they would eventually die sooner. And the possibility exists that will happen, but that's persons who you need to strengthen your mind. Because your mind is one of well, of course, your spiritual body is the most important and the strongest body. Then the supramental and the mental, those two bodies comprise the mind. So unless your mind is fortified and your mind is one that is resilient, if you find out you get sick, then you have no other choice but to fight whatever it is you have to fight. If you have to now take care of yourself, change your diet, those type of things. And a lot of people sometimes don't like to make those changes. Okay, so I just thought I would have put that in there. Okay, Lee Joseph says, hi, Doc. Clarification on my earlier question. Is my hormonal imbalance getting better if my fibroid in the wall of the uterus is now showing partly calcified? Oh, good. I follow you. I hope you're there still. Yes and no. In the sense that the calcification of the fibroid is just showing that you in a situation where your estrogen, because of not menstruating again, your estrogen levels are very low. So as the estrogen levels go down, the fibroid is going to calcify more. However, there are a number of hormonal challenges that women still experience because remember, you got the fibroids in the first place because of hormonal disruption. So the fibroids was not the only, or it doesn't necessarily have to be the only evidence of hormonal disruption or the only causative factor or symptomology of the hormonal imbalance. So you could end up with problems later on with insomnia, you could end up with depression, you could end up with problems with vaginal dryness and all those things because you currently possibly are still in an issue with hormonal disruption. Tell me if that's my best way to be able to answer that question for you. Okay. Miss Angela Burrows. She says, good evening, Dr. Batson and Associates. I am on dialysis 3 times a week. Okay. However, my iron is low. So now I have to take my Express 3 times a week. Is there any foods you can suggest? I'm 78 years and I am tired after dialysis, living in Montreal. Okay, thank you. Okay, Miss Angela. Yeah, definitely. When you look at, remember, dialysis patients, they always have problem with low iron, and that's because of the inability of the kidneys now which plays a vital role in that aspect of the body, and because of the amount of issues that you're having now, you actually end up significantly with blood or low blood count issues. Uh, what I would recommend, Miss Angela, is if you reach out to us, because I'm going to have to get a lot more information, to us at Batson Associates. That international number there is 868-373-2388. You can WhatsApp us on 868-314-9975. Again, that is 1-868-314-9975. And I'll be able to give you more information or better information because of the severity of that situation. I don't just want to tell you to use something just like that. That'll be irresponsible of me. Okay? And I want to make sure that we seek your best interest. So I suggest you contact us. That international number again is 868-373-2388. 2388. That's 868-373-2388. Or you can WhatsApp us on 314-9975, area code 868-314-314-9975. Okay, Ms. Barrows? Borrows rather. Diane Fox says, good night. What do you have for kidney stones? Kidney stones is a pretty easy thing to get rid of. We normally recommend there's a kidney formula that we have. We have kidney tea. The santulan as well is also good. I saw a question on WhatsApp, not WhatsApp, on our Instagram about santulan. No, not as yet, but very soon, very, very, very soon, we will have it for sale for the public again. Okay, guys? We almost there, after God. All right, Vincia Coffee Charles says, it had shown up of recent about 2 months now. I already had the ultrasound done, and that's the only thing that stood out. Still not sure why the lymph node was there. Okay, right. So this is Miss Charles as regards to the question about the lymph node. Okay, so you did the scan or you did the ultrasound. Oh, still not sure why the lymph node was there. Okay, no, well, you would have gotten a report. So I suggest you reach out to us, and what we could do is get that report, because the report has to say something. It has to say something. Did they recommend something follow up for you? Is this that they looked at it and they said, well, okay, maybe we suggest that we may have to do an MRI or something like that? Do you experience any symptomology with breast pain, any uncomfortableness in the breast? If you do the self-examination, do you feel like lumps in your breast? All those questions you need to ask, because as I said, there's a saying, where there is smoke, there is fire. Right, so make sure and pay attention to that. Sorry, you could always follow up with us. Okay, J Love says, thank you. I live in Canada, and several doctors have advised removing the gallbladder because it cannot be flushed. Thanks for your knowledge. Will review again. Yeah, definitely. No, I totally disagree with that. And that is something that a lot of doctors say, that because of the location of the gallbladder, gallstones cannot come out or be flushed out of the gallbladder. That's not true. That's not true at all, at all, at all, at all, at all. I totally disagree with that. Okay, Annette Robinson says, good evening, Dr. Batson. Blessings to you and listeners. I purchased 2 Santulan in September. It still has 1 left. Is there an expiration, or is what I purchased still usable? Yeah, you can use it still if you bought it September. That's September last year, right? Yeah, that is definitely usable. You can use it still. That product is very well sealed, and the expiration date is normally 2 years. To be all honest, I actually kept a Santulan for like about 3 or 4 years, and I used it, and it worked. It still worked because of where it was stored. Okay, guys? Cassie Rampol. He said, Dr. Batson, I appreciate your knowledge and time to share. I saw a doctor that said people think cancer is a death sentence, but it's actually saving your life. It's your body telling you something needs to change. Um, yes, definitely. I agree. In the sense, from that would most likely be, I don't know if that was a holistic doctor that told you that, but what I could tell you is this, cancer is always an indication of serious disruption in the body, disruption as it relates to inflammation. So what cancer really is a result of excessively high inflammation in your body. And as you rightfully said, Cassie, it is your body telling you that something is significantly wrong. Now, I'm not going to go into the politics as to why doctors recommend chemotherapy and radiation, and if I would agree with someone to do chemotherapy and radiation. What I can tell you is this. Cancer, if it is dealt with properly, there is a lot of pain and suffering that people do not go through, or would not go through, simply because they understand what cancer really is. And I believe, quite frankly, the medical fraternity up to now don't really understand what cancer is. A lot of persons in the medical fraternity, including oncologists, don't understand what cancer is. I'll give you an example. There was a client who came to us some years ago, and we sell Alkagen water, which is a premium alkaline water that we carry at Batson and Associates. And one of the things that happened is that when she drank the water, now this is the first time this person is drinking alkaline water. She has never ever in her life drank alkaline water. So I believe we were doing some sort of symposium or health fair or something like that. And she came and we told her about the water, and she bought the water. So she bought the water. We had her contact information. She had the office information, sorry. And then what she did, she called the office about 2 days or a day afterwards. I think we did that symposium or the health fair was a Saturday, and she called the office the Monday. And when she called the office saying that she had, since she drank the water didn't agree with her. So I said, what do you mean the water didn't agree with you? And this was a while ago. I didn't even dream to have office and staff and that type of thing. So I would have been the person who answered the phone, right? That's to tell you how long I've been doing what I've been doing, right? So she said, I'm getting a lot of gripe. I'm getting a lot of belly pain. I said, okay. I said, we remember alkaline water or Alkagen water being a premium alkaline water with high levels of oxygen. It is a mineralized water, and the water is also alkaline. It is going to do some cleansing to the intestines. And one of the things you shared with us is that you usually do not have proper bowel movement, which is why we recommended that you use the water in the first place. Or they follow the story good, right? So the thing is now, what she said, hear this now. The Tuesday morning now she called and said that when she started to go to the washroom, what happened when she started to drink the water, which was since Saturday, she started to get this belly pain, this belly gripe, which got worse, and then she eventually got a bowel movement. So she called and complained and said that whatever we gave her is not agreeing with her because she's passing black stool. Listen carefully to what I say, right? She said she's passing black stool. I said, you're passing black stool? You said, no. She said, yes, I'm passing black stool. And I went to the toilet. I have a diarrhea more than once. I'm only going in the washroom since I'm drinking the water. And the reason why I'm giving you this information is because of what Cassie Rampol asked. So the thing is, what that water showed that lady is that something was severely wrong with her. You do not have black stool. If you have black stool is a sign of what? Black stool is a sign of auto-intoxication. That is a sign of the body poisoning itself. That is almost to the point of sepsis, which if you do understand what sepsis or septic infection is, people don't live. If you get sepsis in the hospital, most of those persons die because of how severe the infection is. So if you get in black stool after drinking the Alkagen water, well, that water saved your life. And as you rightfully said, Cassie Rampol, the doctor was quite correct because cancer is saying to you, listen to me, something is wrong. The unfortunate thing is a lot of the times people do not detect cancer in its early stages. Because remember, the cancer, you have stage 1 cancer, you have stage 1, you have stage 2, you have stage 3, you have stage 4, you have stage 5. Why is it that most of the persons who are diagnosed with cancer, they are diagnosed at the end stages? You know why? Because they did not pay, or they may not have been paying attention to their body. That is why. That is why. So as I said, this session that we're having, this hormonal, so you all see, we start talking about hormonal disruption, and you all know how I usually do the program. I'm going to try my best to answer your questions because that is why I came on the live. You may not, the problem that I'm discussing may not necessarily affect you, but at the end of the day, we share information to help persons to make better decisions and be able to take better care of themselves. Okay, so that telephone number again and location. Keep in mind the symposium taking place at Batson and Associates on Sunday, 21st of July. That symposium is open to the public. However, you need to register. So you can call that number for Shogunas. That number again is 222-8261. That's 222-8261. Debe, that telephone number for Debe is 223-7515. And I'm giving the other numbers just as regards to your consultation, coming in, having your visit, bringing that information that you have. If you have scans, you have blood reports, you can bring those. We always recommend you do the live blood and the dry blood because of the extent of what we actually have the ability to see and to assist persons in. We may send you for additional tests, maybe an ESR, maybe a prostate test based on what we see. Because, of course, our objective is to be proactive, as opposed to being reactive. That's the problem with us, you know. The Western world is very reactive. Well, Trinbagonians worse yet. We only react when it's only when water more than flour, then you come in and you're like, you know, the old people ever saying, you're like fish out of water. A lot of persons are not proactive. A lot of persons wouldn't come to Batson Associates and do a blood analysis, a scan, or a magnetic resonance analysis, come and buy Alkagen water, or come and get Santulan, which is the 7-channel detox, because people wait until they are sick. You're done in the ground, they're done ready to put you in the ground, and then you're coming to us. That don't make any sense. Now, we have helped persons like that. I'm not saying no, you know. It had persons who came to us on death's door, and they are alive today. Thank God. Thank God they are alive. But a lot of persons need to be more proactive with their health. They need to be. Okay, guys? Mel St. Louis says, as soon as I turned 40, my face started breaking out like a teenager. I had never had bad skin. Also, I had fibroids 10 years ago, and after visiting the doctor, it came back. I don't want to do surgery again. What are my options? Mel, you need to come to Batson and Associates. That's the best thing I could tell you. Bring your ultrasounds, bring all your reports, make your appointment to do your blood and your scan. Let us get a consultant to sit with you, and I could always review your information. Because that, of course, is an indication, as I said before, of hormonal disruption. Hence the reason I did this program. So, ladies, this is a serious thing. As I said, it's a 4-part series taking place every Monday, this being the first Monday. And then, of course, we go the Mondays after that, which is going to be what, the 15th. And then 15 and 7 is what, the 22nd. And then the 29th going to be those dates. Okay, you are listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates. We're discussing hormonal disruption in women. Keep in mind, we are live on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. And on YouTube, we are Batson and Associates Trinidad. When you look at hormonal disruption and the question that we just got there, you know, when you're speaking about insomnia is a clear indication of hormonal disruption. Women who go through what is known as PMS, postmenopausal syndrome, actually experience insomnia where they cannot sleep. Now, the reason for that is because hormonal disruption severely affects the central nervous system. So in affecting the central nervous system, it not only causes insomnia, but it also causes depression, severe depression at that, anxiety, and these can all further lead to a nervous breakdown. So ladies, it is very important that you pay attention to yourself and understand that your hormonal balance is very, very important. And that is actually one of the things that we deal with at Batson and Associates. Because as I mentioned before, when you have hormonal disruption, you have so many different challenges. Weight gain. There are some women who would run around the savannah, just using an example, for weeks, months, and you're not losing a pound. You're following your diet, you're eating well, you're drinking water, and you wouldn't lose weight. You know the reason why you're not losing any weight? Especially by your belly and around that abdominal area, around your thighs, is because of hormonal imbalance. When you have hormonal imbalance, it interferes with a woman's ability to metabolize fat, and it also interferes with her ability to lose weight. And that is where we come in at Batson Associates. So, of course, feel free to give us a call or visit that number. And for the symposium taking place at Batson Associates, that's our Shogunas Symposium that's going to be taking place this month, the 21st, I believe it is. Yes, the 21st of July, Sunday, the 21st of July. And you can, of course, call 222-8261. Again, that's 222-8261. Or you can WhatsApp us on 314. That's 314-9975. Sunday, the 21st of July at our head office there. That's at Batson and Associates, the first floor of Money Talks building in Montrose, Shogunas. You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates. They really say when you're having fun time, this fly is actually 9:27 already. But I have some questions here, so let me see how much I'm able to answer for you guys. And Leger says, good night, Dr. Batson. What is the best time to take the wheatgrass? You can take your wheatgrass first thing in the morning on an empty stomach with a glass of water. You can also take it last thing at night on an empty stomach as well. You could also use it to help as a meal. You could take like about 2-3 packs, mix it in a glass of water, and drink it, especially if you may not be able to eat at a particular point in time. So let's say you have to go to a meeting or something like that. You take your 3 packs, you mix it, you throw it inside of there, and you get yourself in a gear. Miss Elizabeth Nandla, she says, hi, Doc. Good night. I'm exceedingly late. That's no problem. Miss Elizabeth Nandlal asked the question. Oh, we have a lot of questions, boy. Okay, nice. I like that, man. Only giving my work. Elizabeth Nandlal says, just to let you know, I am almost there with the cartilage. Good, I know would ask you that. Soon I will be back in the gym, etc. Thanks for the great help. Lord, I need Santulan. Really, that's you and I. But we almost there. We're getting our Santulan shortly. Lee Joseph said, I think I understand what you are saying. I am far from menopause, have been using the Uterine Plus and Women's Formula and the Alkagen water together with a veggie-rich diet. Okay, good. Excellent. Gemini D said, did you get more of the detox, Dr. Batson? No, we didn't get it as yet, but as I said, this month for sure. This month is here. It's just a matter of getting certain clearances for it. Okay, guys. Joan Williams wrote. She says, good night to the best doctor. Thank you very much. Alicia Spears says, knowledge and application is powerful. I love that. Knowledge and application are powerful. Alicia, I totally agree with that. Let me read it again, just for emphasis. Knowledge and application are powerful. Marshall says, so right, Doc. They make excuses and blame everything on a gas pain. Yeah, you're sure right. Ms. Elizabeth Nandla says, Doc, I'm listening to you on the stages of cancer. Is there any way we can detect stage 1 or 2 on our own? That's actually a good question. I mean, the thing is, it may not be called stage. Well, yeah, definitely, actually. Because I've had clients that I've worked with who came to us and actually, because of our intervention and because of using our products and services, they actually had issues before. And then in working with us, when they went and did subsequent studies and MRIs and CT scans, they were actually able to find stage 1 cancer. So, there was also an instance where we had someone who discovered stage 2 cancer. And in both instances, they actually went about to do the surgery to remove the organ. If it was me personally, I always give persons the opportunity to make the decisions, because I tell them in the final analysis, you have to live with the decision that you make. So I'm not going to make a decision for you. Right? And they agreed to remove the organs that were giving problems at that time, and they fine now. They're quite fine. So there are ways, as I told persons, when you look at the blood analysis that we do at Batson Associates, we cannot use the blood analysis as a diagnostic tool. However, I will tell you this: a trained blood microscopist, and with what the body and what blood tells us, if it is you have early stages of cancer, I am going to send you to do additional tests. I'm saying that to you. And we have done it on numerous occasions. And the reason for that is because of what that blood tells you. Blood doesn't lie. Blood is the greatest witness that it has in the human body. Why do you think blood is the most tested serum? God gave mankind knowledge, The Bible says we are created in God's image and likeness. All I feel that only has to do, when he says image, they're talking about our ability to think, our ability to use our cognitive function, our ability to reason. And mankind found a way to take blood out of the human body and test it and be able to help mankind. So you don't think, if it is you're able to look at how blood has the ability, because there are visible signs of inflammation when we do our blood analysis. I'm not asking you, I'm telling you. I have seen persons when we do blood analysis, and I have personally realized that their inflammatory response is so high, which is evidence when you do the blood. And we had to send them to do ESRs. And when we sent them to do the ESR was 60 something and 80 something. There was someone who came to us who, when I sent them to do the ESR, they had an ESR of over 100. And they were tested. And when we started to work with them, we started to work with them and bring it down, because they were already working, in my personal opinion, at a stage 1, stage 2 cancer. So the body speaks to you, and that's what I said at the beginning. But a lot of times we do not listen. Okay, guys, Don Lowe says, good evening, Dr. Batson and everyone else. Gemini D, do you treat gas and bloating? Yes, we do. We treat anything. The only people we cannot help is the dead and the hardened. People who are hardened, who do not listen, who do not follow instruction. Because they came to us first to help you. So how you will come to somebody? That's like you go to an attorney give you advice and you decide you're not listening to what the attorney tell you. Or you go to an architect or an engineer or whatever the case may be. We can help you. We can help you. Once you're willing to, we will work with you. People talk about price. So we know there's a financial consequence to everything. But believe me, we have helped people with $200. $200 if we're looking at price. Because everything we sell at Batson and Associates can help you. Every single thing. I don't sell rubbish. I always tell people that. And we know the work that we do. Okay, guys? So our time is basically up. It's 9:34. I'll finish in the next 6 minutes, so I'll go to 9:40. So keep in mind this program that we are having. We're discussing hormonal imbalance, hormonal disruption in women. Ladies, I applaud you, and I petition you to send this live out, to call your friends, tell your family, all the women that you know, to come and have some sort of listening. It doesn't take to listen. People, let me tell you something, Gemini, this is correct. I have used some of the products and it worked well. Okay, great. I'm glad to hear that. With the gas and bloating, one of the products you could look at, Gemini D, and we didn't have it for a while, is the digestive restore. We also have the digestive balance back in stock as well. And we also have, I believe we have gastro tea. If we don't have tea for the gastro tea, we will get gastro tea. But we have stuff that could help you there. So you could always call and get some information, seeing that you would have used some stuff from us before. Yeah. So the point I was making, so I was telling you guys that, there are a lot of persons out there who get information, they put off things. Okay, the gallstones. All right. Well, we're gonna work on that gallstones things. And Leger says, good work, Dr. Batson. So much information. You're very welcome, my dear. Yeah, so the point I was making, that is, and I said that is why I decided to do this hormonal disruption situation, because ladies, I love my mother, as I always tell people, love. Ask anybody, they tell you about love, right? Grandmother, great grandmother, really strong woman who played a significant role in my life. Right? I'm not saying the men didn't do anything, don't get me wrong here, but the ladies did really, really well. So I have a certain amount of love and appreciation for them. And I know no one out there wants the queen to be feeling sick. And ladies, gentlemen, men who listening to this program, if it's your mom, your wife, your sister, your daughter, let these ladies know that they need to help themselves, because this hormonal disruption thing not nice. Anything, I'll say it again, anything that could cause a human being to contemplate taking their own life is a serious matter. I don't know how much serious I can put inside of that sentence. This is not a joke, people. Women with this bad hormonal disruption, it's terrible. You could imagine having no control over your tears. You could imagine that. Women with severe hormonal disruption will cry at will. You could do so and just say, cry. And they cry for you. And I'm talking no joke cry, Oscar Awards, Academy Award winning here acting. I'm talking about do so, cry, and they could cry. And when the tears ready to come, these women could be where, in what situation? They crying like if they lost a child or their mother or something, you know. That is the extent of what hormonal disruption can do to a female. So this is not a joke. You have people contemplating suicide to kill themselves because of how they feel. You have, you know, how long all you could go without sleep? Hmm? Let me ask you a question. What's the longest you ever go without sleeping? Anybody answer me. What's the longest you ever go without sleeping before you start to feel you're going mad? Hmm? Anybody? I think the longest I went without sleep was 2 days. And that's because I was studying. So I deliberately did that to myself. 2 days. I think I didn't get any sleep. But what's the longest? These women, 1 day, 2, 3, 4, 5. There was a client who came to me, she didn't sleep for 10 days. You know what it is? You didn't sleep for 10 days. If you see how the woman was shaking, trembling, she couldn't stand up. And she got a panic attack in the office. It's one of the worst things I ever seen in my life. This hormonal disruption is not a joke, women. It's not a joke, ladies. And even for the younger women, this polycystic ovaries, which is a sign and symptom of hormonal imbalance and hormonal disruption, is not a joke. There are women who get menstrual cycles so painful that they cannot go to work. How you could live like that? Lee Joseph said, probably 24 hours. Then you start to hear cloudy and feel lightheaded. Gemini D say, are you saying that hormonal disruption can affect sleeping women? Of course. Yes, my dear. Yes, my darling. Listen to me. That is one of the main symptoms. Listen to me. Let me tell you something. All you feel this thing is a joke. I tell you earlier, the reason why I speak the way I speak and why people say, Dr. Batson, I love what you do. I really love what I do with all my fiber and my being. But what I feel sorry for, I feel sorry when people do not know how to get help. And there are women there. I am telling you. There's a woman came to me, she didn't sleep for 10 days. You know it is, you know. And I talk about they give her sleeping tablets and she still can't sleep, you know. You could imagine how you're feeling. Do you know it is worse to drive sleepy than driving drunk? You know why? If you miss sleep, you cannot go and handle machinery. Your cognitive ability, your ability to reason, your reflexes, and those things go out the door when you're not sleeping properly. So you could imagine a woman not sleeping for 10 days. I would not have liked to be in that body. I tell you, if you see how that woman was looking. I told her family, I said, we wouldn't do any tests on her today. I'm going to make a general recommendation based on my knowledge and expertise. And then you're going to bring her back in a month time. And that is how the lady was able to come into the office the month after. Because all I did was made a recommendation for her to use certain things based on my expertise. And she was able to come. She started to sleep. 10 days she did not sleep, ladies. Look, Miss Elizabeth Nandla says, Doc, I have a friend who cries at will due to that menopause. I'm real glad I'm spared that condition. I could only make one night without sleep. Yeah. So you better send this information to her because there are a lot of people. And let me tell you something, ladies. If you do not fix this, the only thing madhouse will pick you up. You are going to end up with a nervous breakdown and you're going to suffer unnecessarily. You have the hot flashes, you have the sweating, you have the vaginal dryness, you have the irritability. Or you don't want to talk to nobody, you don't want to hear nobody, you don't want to see nobody. You ain't want to see your husband, your loving husband that you have for how much years. You ain't want to see Papa right now. Move. And the poor man feeling that he don't know who's this woman he living with now because you changed. But you didn't change because you wanted to change, you know. The hormonal disruption is what have you in the situation that you're in. Okay, guys? So Keep in mind those telephone numbers and locations. We are located on the first floor of Money Talks building. That's Money Talks building in Montrose, Chaguanas. Remember our symposium taking place at our Chaguanas office. That is taking place on the 21st of July, Sunday, the 21st of July. So it's a Sunday we have in that symposium. And I believe it is Sunday afternoon. So you could go to church in the morning and then you have your afternoon time. We're going to have it posted up on our social media. Remember, you can follow us, share us, like us. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. And on YouTube, we are Batson and Associates Trinidad. You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates. And this is the first segment of our four-part series on hormonal disruption and hormonal imbalance in women. Miss Alicia Spears said, yes, Elizabeth Nandler says, but doc, don't feel women alone have sleep issues. Men too, eh? I know men have sleep issues, but y'all don't understand how this hormonal imbalance affects. No, men suffer from hormonal imbalance too, but I'm not dealing with them yet. I'm dealing with all you. So let me get everything correct. We deal with the ladies first. I will deal with the men and them after. But ladies, this thing not nice. It's not nice at all. So mind all your business. Share the live. Keep in mind we have 3 more programs as regards to this. And keep in mind that symposium that is going to be taking place at the Chaguanas office. It is going to be Sunday, the 21st of July at the Chaguanas office. You need to register for the symposium before. So you can always call us on 222-8261. That's 222-8261. As well as WhatsApp on 314-9975. Okay, Gemini D says, I always promote Batson and Associates to everyone I know. Thank you so very much. Lee Joseph said, question, can low estrogen cause fibroid shrinkage? I wouldn't say low estrogen rather, but estrogen balance, the proper amount of estrogen that a female is supposed to have, because excessive estrogen causes fibroids to enlarge. What happens with women when they go through menopause and the estrogen levels are much lower? What happens? The fibroid actually begins to calcify. Now, doctors tell you, well, oh, the fibroids calcify, and that's a good thing. It's a good thing, yes, but you don't want the fibroid in the first place. So there are things that you could use to break that down. The problem with most women now is that women do not do vaginal cleanses. They do not do uterine cleanses. They do not do detoxes. And that is why they have all the build-up with all these things in the body. Okay, Miss Christine Mayhew says, hi, Doc. How do you manage estrogen dominance? Estrogen dominance, again, is a sign of hormonal disruption. So again, you need to actually balance the hormones. Okay, guys? Ms. Jennifer Valentine says, Dr. Batson, I'm trying to get all my relatives who are women to come to you. Okay, I hear you, my dear. Alicia Spears says, take one woman's formula and mind all your business, ladies. Alicia, I like that. I love that. I love that. Women's formula is actually one of the products that we use at Batson and Associates to assist women in these issues. So again, it's 9:45, so we're going to bring our program to an end. Let me, of course, thank you all, to our technical person. I wanted to thank Shakil very much. I called Shakil just today and tell Shakil I needed to do this live, and he has made himself available. So, ladies, you all owe Shakil a round of applause for helping us out there. And of course, keep in mind, we have this program for the next 4 Mondays. We have our regular scheduled programs, which are the Thursdays. So Thursday morning from 11:05 to 11:35. We also have DJ Mamu on djmamuradiott.com, which is 2:15 to 3:15. And we have our Synergy people. That's Synergy, which is from 5 to 5:15, is that Synergy program. Keep in mind, again, our health symposium taking place at our Chaguanas office. That's Sunday, the 21st of July. So all roads lead to Chaguanas head office. That's the first floor of Money Talks building in Montrose, Chaguanas. And I know we have something. Our health symposium for Port of Spain is actually going to be in August. So I'm going to have that additional information for you. Those of you in Tobago, keep in mind Tobago Batson Associates will be with our consultants and myself. We're going to be there, God's willing, coming down to the month end, the end of the month, God's willing. So you could always call that office and get that information. As we always say at Batson Associates, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. Alicia Spears says, thank you, Shakil. Shakil says, you're welcome, Alicia. Take care, guys. God bless, and enjoy the rest of your evening.